As David had rightly said, Malaysia is pretty much warm and humid. Hence, we are not really exposed to extreme changes in temperature throughout the year. Our temperature ranges from 23 at night to about 34 degrees in the afternoon. This talk pretty much is probably more relevant to those from northern or southern countries below the Tropic of Cancer, where you experience 4 seasons in the year. Having said that, I did spend 2 decades of my life studying and training in Ireland, and that's quite far north. For those of you who have been there, the summer is always cold and wet with one sunny day, and that's pretty much it. That's all you get for the rest of the year. On that note, I shall be taking you through my talk on the treatment strategies for hypertension in extreme weather. And I shall be discussing on 3 points: effects of extreme weather on cardiovascular disease, and of extreme weather on blood pressure, and how we should approach adjusting treatment for patients with hypertension in extreme weather, and what are the implications. So as we all know, global warming is on the rise. Temperature has risen by almost 1 degree over the past 60 to 80 years. And this has resulted in erratic weather across many countries in the world. We're experiencing drought in places where we have tropical forests. We're experiencing the melting of the ice cap, rising sea levels, etc., etc. And certainly some areas, such as us in Malaysia, we've been experiencing heavy rain for a good number of months now, lowering the early morning temperatures very nicely. But sometimes we have extremes where you have dry weather in Indonesia, for example, contributing to forest fires and haze, which really does increase the incidence of respiratory tract infection, for example. Weather has multitudes of effects to the onset of many types of disease. We'll be focusing on cardiovascular disease here, but quite interesting that this paper from Spain showed that even warm weather could be the reason why a lot more people are suffering from gastroenteritis, possibly due to increased number of bacteria multiplying in dirty water, or the number of people walking and tourists presence in touristic areas contributing to the number of cases. But it's just interesting that the weather has so much effect to our daily lifestyle. The effects of weather and cardiovascular disease is really not something new. It was first reported almost 80 years ago by this group, Master and Jaffe and Jama, where they were looking at risk factors contributing to coronary artery disease and coronary thrombosis. And what they found was that in the autumn and winter period, there is slightly increased incidence of heart attacks as opposed to during the spring and summer. Although the percentage difference is not that great, with no significant p-value, this trend was observed many years ago. And we have been getting many reports regarding the effect of weather to the onset of stroke, to the onset of heart attack, to exacerbation of asthma and COPD. And it is very important to understand the concept that it has 2 effects to the body. Generally, you can be in a climate, in a stable cold climate, and be safe. Be in a scenario where you are exposed to extreme changes in outdoor temperature, which tends to contribute to a lot of the incident of heart attack and stroke. Here, for example, this study by Hong in Korea showed that ischemic stroke seems to increase the longer one is exposed to a lower temperature, where you, after correcting for humidity and air pressure, the odds ratio of developing a stroke in winter is higher than it is in the summer, almost 2-fold higher than it is in the summer. A similar paper in Japan looking at the onset of a stroke found that the temperature seems to play a role for women, but not men. where the odds ratio of developing a stroke when the winter is extremely cold for more than 10 days is roughly between 5 to 6-fold higher compared to the summertime. In Ireland, you could really get 4 seasons in one day. In Malaysia, it's either hot and sunny or hot and rainy, and the odd haze that pops up every so often. But in the summertime, where the temperature is balmy 20 degrees, you could still be exposed to sudden onset of hail and sleet, making life quite miserable for the rest of the afternoon. Here, there's this paper in Germany from Europe that shows that rapid changes in temperature, in ambient temperature, is associated with increased presentation to the emergency room department. So if you were to have changes in temperature of, say, 5 degrees dropping from, say, 20 to 15 or 15 to 10 degrees, the odd ratio is almost 30% increase for someone or patients to present themselves to the emergency room department with a chief cardiovascular complaint, i.e. chest pain or breathlessness. There is a lag to when somebody is exposed to a change in weather. For example, immediately after you step out of your office or your hospital or your room or your home, where the ambient temperature in your room would be around 20 to 24 degrees, and the outside temperature is lower, say 10 to 12 degrees, immediately you will start to experience vasoconstriction, increase in heart rate, and subsequently your blood pressure will start rising. Most people will normalize in a few minutes. Some who are exposed, who have hypertension, would see an increase in their blood pressure. Some would suffer events immediately. However, in this German study, you can see that a drop of temperature by 5 degrees is associated with cardiovascular complaint to the emergency room department. And they also took into account the lag, how many days a person is exposed to change in temperature. So it does not necessarily happen straight away. It can manifest itself up to 3 weeks after being exposed to sudden change in temperature. If we were to look closer to home, here's a study from Taiwan, sampling 4 cities, 2 in the north and also 2 in the south, looking at the presentation of patients to the emergency room department, either with a cardiac complaint or a respiratory complaint. And what they found was that when the weather is in the extreme, ambient temperature suddenly dropping, or the very, very cold, very hot, up to the 95th percentile of normal temperature, cardiovascular complaint seems to rise in the middle box. And they found that the annual first extreme temperature event and long duration of extreme cold has more association with emergency room visit than the ambient temperature. Even in a country like Taiwan, there's differences between north and south of the city, where the south is slightly warmer than the north. And they found that there's higher percentage of people presenting with cardiovascular or respiratory tract complaints when the weather changes suddenly. When we look at a larger data set, especially that coming from China, city of Guangzhou, Wuhan, and Shanghai are located slightly south compared to Beijing and Tianjin. And you could see that the effect of extremely cold temperature increases the risk of ischemic heart disease by looking at the odd ratio of 1.89. Up to 3 weeks after exposure to extreme cold temperature, where the weather changes by 5 degrees Celsius, as opposed to the very early onset of being exposed to extreme cold temperature between 1 or 2 days, the odds ratio is still fairly low. Why are the odds ratio higher in southern cities compared to northern cities? Now, this is actually quite interesting because it has relationship to how population health is being managed one of the theory is that in cities that are used to cold weather, they have more efficient home heating and office heating system, and the ambient temperature is managed better, as opposed to southern cities closer to the sea, where the home heating system may not be as efficient. And when you have sudden exposure to very cold weather, they are not prepared, and therefore changes in their cardiovascular system occurs, blood pressure rises, contributing to higher incidence of complication. But here we can see it also affects a lot of elderly people. There is a U-shaped pattern in terms of cardiovascular complications in relation to weather, where very, very cold weather affects the elderly with the odd ratio rising up to 1.92 on the column on the right, and very hot weather also affects the elderly with an odds ratio of 1.66, suffering from heart disease and cerebral infarction in elderly Chinese. This is probably down to an inefficient thermoregulation system. Maybe their social support is not very strong. They're not warming themselves up properly when they're at home or going out, or maybe they have other social issues such as inadequate home heating system. These are all some of the theories that is postulated from studies like this. Now, this slide does not come out very well, and I apologize. Similar data coming from Japan, where they sampled 47 Japanese prefectures over almost 30-year period of time, looking at diseases such as asthma, attacks, kidney disease, dementia, cerebral hemorrhage, cerebral infarction. And what they found was, apart from renal disease and cerebral hemorrhage, all the aforementioned condition is associated to changes in temperature between indoor and outdoor, and between daily outdoor temperature, the extreme changes where they change more than 5 degrees in one day. And there is also the association of a lag where the incidence of asthma, cardiovascular disease, and stroke seem to present themselves up to a week later, and many actually present themselves up to a week later compared to 1 or 2 days after being exposed to sudden changes in temperature. And similarly, we see the same effect from our North American friends, where mortality is associated with the cold weather. And now I shall go into how the cold weather actually affects blood pressure. And we have seen some data that pretty much describe countries above the Tropic of Cancer tend to have higher prevalence of hypertension compared to countries closer to the equator. Please do note that the prevalence of hypertension in the population for Malaysia is about 43%. However, the factors contributing to that is probably, part of it is due to diet, sedentary lifestyle, high salt intake, and so on. But what we're interested is there any effect of weather itself to the blood pressure in those living in countries in the northern and southern climate? So we do have data from the MONICA study, which was performed between 1979 and 1999 in 16 countries, and looking at countries above and below the Tropic of Cancer and Capricorn. And what they found was that the higher you are in terms of your latitude, you do tend to get smaller variation in your blood pressure between seasons. And this would say or tell us that maybe these countries have adapted to the changes in the weather better as compared to countries who are closer to the equator, where they would experience changes in the weather and they are less prepared in terms of clothing or household heating or healthcare support. They see a bigger variation in blood pressure swing between seasons. Is hypertension more prevalent in winter? This slide seems to suggest that it is. And as the temperature drops, if you were to look at systolic blood pressure column on the left side, the left left-hand graph on the y-axis is your systolic blood pressure measurement in millimeters mercury. Opposite is the temperature between 0 to 35 degrees. As the temperature drops, systolic blood pressure tends to rise, and they tend to happen during the month of winter, between November to March. The same patterns is seen as well with diastolic blood pressure. In Europe, in Italy, from the Pamela study, sampling about 2,050 women, they saw a similar pattern. And it doesn't really matter whether you measure these blood pressure in clinic, at home, or you do 24-hour ambulatory blood pressure monitoring. Here in the Pamela study, you can see that the values from 24-hour blood pressure monitoring, home monitoring, as well as clinic blood pressure measurement in the column on your right for systolic blood pressure seems to mirror each other quite nicely. Highest in the winter months and seems to be lower during the summer months. There is a pattern for blood pressure variation with regards to weather, and this is an Australian group studying a population near Shanghai, about 50,000 of them who were followed up for about 10 years, and they found that there is a V-shaped pattern in terms of your systolic blood pressure in response to changes in temperature. The lower the temperature, the higher systolic blood pressure, and then it seems to reach less of a variation with a temperature between 20 and 27 degrees. However, temperature above or closer to 30 degrees Celsius seems to have greater variation of blood pressure as well. So now we know that blood pressure rises in cold weather and blood pressure rises in warm weather as well. When it's warm, the blood pressure could rise because of annoyance to heat, for example, or other factors that contribute to it as well. So this is a large study, about 500,000 people from various zones in China, where it's divided into temperate zone, temperate monsoon zone, as well as subtropical zone. And what you can see here is a pattern of changes in blood pressure compared to the ambient temperature outside. And it's quite interesting because, as I mentioned earlier on, cities or population who are located in the subtropical region tend to tolerate changes in ambient temperature less compared to those who are from colder climates, where they are better prepared. Blood pressure variation in those populations further up north is less compared to those sitting closely to the ocean. So a greater systolic blood pressure change due to lower temperature was observed in subtropical zones, especially for cold season. And what's interesting was that they've also isolated that female people in the rural area, as well as elderly population, were more susceptible. So these are people really be focusing when we experience extreme change in the weather. We also have data coming out from India in the area of Jaipur, where they sample almost 1,000 patients, and they monitor them for several years and monitoring their blood pressure during different types of season. And to look at the bar graph on the top right-hand corner, you can see that in the summer, systolic blood pressure average is about 122, and it rises to 131 in the winter. So these hypertensive patients are at risk. This paper from Canada in about 50 with a mean age of 64. These are the patients who we look after with hypertension, and they have hypertension. And they found that when these elderly hypertensive are exposed to extreme cold weather, they have a 37% increase in the risk of presenting to the hospital with hypertensive crisis or hypertension-related complication that needs admission. Similar pattern is seen for diabetes, although the relationship is not very strong. There was no association with arrhythmia. So here they found that 9.3% was associated with exposure to cold temperatures in the moderate range compared to 0.7% extreme temperature changes. What about the hot weather? As I showed you, the Pamela study showed that in the during the summer, blood pressure seems to drop gradually. This is interesting because one might be tempted to reduce the number of blood pressure medications, especially in the elderly, to try and compensate and avoid complications such as postural hypotension and dizziness. However, they also saw that strokes don't actually decline during the summer, especially among the elderly. And it gives rise to the question of why. And from this large study from Modesty, they found that in the rightmost column in C, where the C's are elderly patient, they found that elderly patients tend to have higher nocturnal blood pressure reading during nighttime in the hot weather in the summer. And this could be a problem as well because they do have a higher degree of blood pressure surge early in the morning. And that could be the reason why, despite a lower summertime blood pressure reading, the elderly patients are still getting their stroke because they are getting their early morning surge and their nighttime systolic blood pressure is also higher, i.e. they're not adequately controlled. So this pretty much should be flagged because we do need to pay attention to them closely in terms of medication, timing of medication, how they take the medication, and whether or not they are getting side effects from the medication, rather than having a blanket of withholding medication or reducing medication during the summertime for our elderly hypertensive patient. The elderly and the very poor are very susceptible to temperature changes. In the heat of the summer, where due to poor accommodation, they might experience a rise in blood pressure as opposed to a drop in blood pressure. And it's probably because their bodies are heating up. Now, some of the mechanism that is associated with the weather. In the cold, it could be due to vasoconstriction, activation of sympathetic nervous system and tachycardia, as well as the retention of sodium and water, as well as of impaired endothelial vasodilatation. In the heat, the reason why the blood pressure drops is because of water loss and also from vasodilatation. Please note that if the nighttime temperature is high, as for example in the summertime, it could also result in high blood pressure, and one of the postulated mechanisms will probably be due to reduced sleep duration. The weather also plays a role in the winter. The lack of vitamin D due to the short exposure to the sun, reduced daily activity, as well as weight gain are all contributors to higher blood pressure. We did not talk so much about altitude. However, people who are not used to high altitude tend to experience hypoxia and activation of their sympathetic nervous system, and a rise in their adrenal activity can contribute to high blood pressure due to a stress response. However, those people who live like in Tibet and the Andean Alps, for example, who are already acclimatized to high altitudes, they seem to respond by having a lower blood pressure compared to those who are not used to high altitudes. I've shown you slides on the effects of latitude to the incidence of hypertension, and some of the possible mechanism would be to genetics, where ancient migration resulting in changes in how the body handles salt and water retention, especially moving from equator to northern climate where both are readily accessible. So how do we adjust our treatment in extreme weather? It's not really that straightforward. If there is a patient that you're considering having uncontrolled high blood pressure due to weather exposure, they should really be advised to dress appropriately, look into the home heating system, look at the support system. The treatment option is not just one size fits all, because we do have to look at the individual, at the community, and at the hospitals. For example, guideline mandated therapy are all in the guideline. There are no mention about adjusting treatment for hypertension during extreme weather changes. However, I have shown you a slide that the blood pressure tend to drop in the summer. So there are certain population who are at risk, i.e. the elderly and the poor, who we should really be paying extra care and extra attention to in terms of their medication, maybe reduce the dose of diuretics, but monitoring their blood pressure closely, because we do know that these patients are susceptible to early morning blood pressure surge, contributing to target organ damage such as microinfarcts in their brain. Public health interventions such as better for homes and making sure that the community have support for these patients who are exposed to extreme weather variation is also.
Prof. Sazli, sorry to interrupt you.